"40,000 early deaths that result from air pollution every year in the UK.
Almost 10,000 Londoners each year dying prematurely.
It's a silent killer."
It seems at times we can get caught up in alarming assertions about air pollution, that this is a public health emergency, that it is a silent killer, coming from politicians, campaigners, and even us journalists. But how bad is air quality in Britain, really?
Tony Frew is a professor in respiratory medicine and works at Brighton's Royal Sussex County Hospital. He's been looking into the recent claims about the air that we breathe.
Well, it's not a crisis. It is a problem and it affects people's health. But when people start talking about the numbers of deaths here, I think they're misusing statistics and it leads to an erosion of trust. There have been tremendous improvements in air quality over the last 40 years. There's a lot less pollution than there used to be. And none of that's coming through in the public discussion of this problem.
So what does Professor Frew make of the claim that alarming levels of toxicity in the air in the UK causes 40,000 deaths each year?
It is not 40,000 people who should have air pollution on their death certificate or 40,000 people who definitely died from this. It's a lot of people who had a little bit of life shortening as a result of the air pollution.
To examine these figures further, we travelled to Cambridge to visit a renowned statistician. I asked him about the data on which these claims of 40,000 deaths a year rely. They come from a study on how mortality rates in US cities were affected by pollution.
First of all, it's important to realise that that 40,000 figure breaks down into two parts. 29,000, which are due to fine particles, and another 11,000, which are due to nitrogen oxides. And I'll just talk about this group for a start. These are what are known as attributable deaths. They're almost virtual deaths. They come from a complex statistical model. Well, quite remarkably, it all comes from just one number. And this was based on a study of US cities. And they found out that by monitoring these cities over decades, that the cities which had a higher level of pollution had a higher mortality rate. They estimated that there was a 6% increased risk of dying each year for each small increase in pollution. So this is quite a big figure, but it's important to realise this is only a best estimate, and the committee that advises the government says that this figure could be between 1% and 12%.
So this 6% figure is used to work out the 29,000 deaths a year in the UK?
Yes, through a rather complex statistical model. And a similar analysis gives rise to the 11,000 attributable deaths from the nitrogen oxides.
So why does all this matter? Well, should we ban diesel vehicles? How much should we invest in cycling? Should we build a third runway at Heathrow? We need reliable statistics to answer those questions, but can we trust the way data is being used by campaigners?
I think there are people who have such a passion for the environment and for air pollution that they don't really see it as a problem if they are deceiving the public.
Greenpeace have been running a campaign claiming that breathing London's air is the equivalent of smoking 15 cigarettes a day. Is that statistic right?
No, that's completely wrong. If you smoke 15 cigarettes a day through your adult life, that will definitely take 10 years off your life expectancy. If you're poor and you're in social class 5 compared to social class 1, that will take 7 years off your life. If you're poor and you smoke, that'll take 17 years off your life. Now we're talking about possibly, if we could get rid of all of the cars in London and all of the road transport, we could make a difference of 2 micrograms per metre cubed in air pollution, which might save you 30 days of your life.
There's no doubt that air pollution is bad for you, but if we exaggerate the scale of the problem and the impact on our health, are we at risk of undermining the case for making Britain's air cleaner?
Exhale, exhale, exhale.